you are in the political arena these days, I want to talk to your colleagues that please let us not politicize matters healthcare. Let us all work together to ensure that the process of healthcare does not stop and stall. Go and move 3 steps forward and then 2 steps back because of the political individual considerations. We must always ensure that we tackle healthcare in a very non-political issue. So, as I conclude, let me remind you that COVID-19 is still here with us. However, as Madam Okwara said, we now have vaccines. We want to ensure that we get vaccinated. It is not mandatory to get vaccinated. I have emphasized that. It is in your own interest that you do so. We have said that if you want to visit certain institutions, you will need to be vaccinated. But it is not mandatory that you visit those institutions. So you don't have to be vaccinated. To travel overseas or to get into an aircraft, it will soon be every country on earth will require that you be vaccinated. But you don't have to travel anywhere. So you don't have to be vaccinated. To come to the government office, including mine, you do need to be vaccinated. But again, you don't have to come to my office. So I think, it's a free country. It's a free country. We don't force anybody to do anything. You do as you wish, but you also, actions have reactions. So when you take whatever decision you have, appreciate that there will be some responsibility that comes with it. Finally, even without, like my friend, Professor, like you, I do not think that I want to say anything political. Because as everybody knows, every politician resigned yesterday. Is it yesterday? The day before yesterday. Every politician has resigned to go and seek a political position. And as everybody knows, I have not resigned. So by virtue of that, I escaped the political arena. But I am a Kenyan. I am a Kenyan.
Let me not do what Wambora.
I am a Kenyan, and I know what the landscape of our health sector looks like. And I couldn't agree more with Professor Nisheni, that honestly what is required is continuity. Nations develop because what has happened in one government continues on through the other government. That's why, all the way from independence, Kenya has made certain strides that are absent in our neighborhood because of the continuity that our nation has had. We have developed ourselves, we have made ourselves and developed to a full democracy, where indeed people make the choices that they want, and they choose the governments that they want. But I think it is imperative for us never to get to the point where we abuse that knowledge. We abuse the fact that we are Democrats to rebel against a system, not because a system is bad, but because by nature, people generally, especially the younger people, are generally in opposition of whatever status quo, whatever status quo exists. I want to urge us, in making a political decision, to make a decision based on fact, not emotion. Because unfortunately, what happens during a political period, everybody becomes so emotional that logic goes through the window and reason is completely absent. Sometimes, honestly, and it's not just a Kenyan thing. Sometimes I honestly watch nations when there is a political period, an electoral period, and you ask ourselves, Have we actually been to school? You know, tumesoma lakini kama tumesoma, unawezaje kuona vile mambo inafanyika? Unawezaje kuona vile mambo ilivyo? Iko hospitali haijamalizika na unaambiwa huyu ndio anaweza maliza hiyo hospitali. Huyu sijui. Huyu ndio anaweza maliza barabara. Huyu sijui. Huyu ndio anaweza maliza ile kazi inayofanywa na serikali. Huyu sijui. Alafu wewe mwenyewe na macho ikifunguka unasema yule ambao hatujui atafanya nini, wacha nichague huyo. Hai, jameni. You know, am I the one who is missing a point or what? You know, so people, I urge you, Kenyans generally, you know, let's think very, 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 very carefully as we go. I urge the church, because we are sitting in a PCA setting. And one of the reasons why you say that I'm always in PCA events, one of the reasons why is because my mother is an elder in the PCA church. So you will understand that I don't explain that. I don't need to explain that. And my mother is not a person who takes no easily. But I'm also a beneficiary of USAID like you, Lawrence, because I was taken by USAID for training way back in 1991 when I went for training in the Washington Graduate School in computers and ICT. So that is where I also developed my passion for ICT. I'm an alumni of that training, and I thank USAID all the time and the American people, because USAID is an extension of the American people. And I think that if you look at the landscape in Kenya, the relationship we have developed with the United States goes all the way back to 1959, when the real training of Kenyans was first established during what is known as the Kennedy Airlift. It is when thousands of Kenyans were taken to the United States for training so that they can come and take over a new nation in 1963. And at some point in the 1960s, if you looked at the Kenyan cabinet, 75% were people who had been trained in the United States of America. And that might explain why our friendship continues to grow and thrive to this day. And at some point, the NHIF was being used as a cash point. Literally, people would walk into hospitals, have the NHIF card charged, and money given to them. That's how bad it was. And that's why we introduced the biometric registration, where the identity of an individual is clear now. They will use their thumbprints. There will be no cards issued. And moving forward, it will be reimbursements will be a lot faster. Because as soon as you put your thumbprint, it registers itself at NHIF. When you finally send the invoice is automatic and direct. There are no papers that will be sent from the hospital to the NHIF headquarters. So what we are talking about is the bulk of what was happening prior to the introduction of the biometric system. We are reconciling all those figures, and I promise you that you will get your money. That I want you to know. On the issue of the contractual discussions that are ongoing, let me also appraise you and to tell you, we agreed that by the 31st of March, we must complete those negotiations. The principle of the entire exercise is that we must bring down the cost of healthcare. It must come down. NHIF charges must be sufficient to take care of our patients. And what we are looking for is a scenario where a patient walks in, does dialysis, and walks out without having to go back into their pockets to look for money. And we are enhancing the packages at NHIF so that that happens. When John and I were in Mombasa, we witnessed a surgery carried for the first time because of the new equipment that we have, such as cath labs. Somebody was operated, heart surgery. They walked into the hospital. 450,000 shillings later, they walked out without having paid a cent. This would never have been possible And since we have gotten to the point where we have brought India into Kenya, there's no need to travel to India anymore. We have sufficient equipment, we have sufficient personnel, and we are training more, as we are witnessing today. So I want to assure you again that our intention is to move in a very consensual manner forward. We appreciate that the work of healthcare, the provision of healthcare services in Kenya falls into three categories. It falls into the government of the Republic of Kenya, it falls into the faith-based organizations, and you have provided the work that has been done by Pcea, by the Catholics, and other faith organizations in terms of supporting the healthcare structure in Kenya cannot be gainsaid. It's absolutely fantastic. And without you, what we are as a nation that cares would not have been possible. So I want to say and to emphasize that the intention is that we are going to agree. The hallmark of a civilized society is the ability to agree to disagree sometimes, right? Sometimes. So that is essentially what we have been exercising, and exhibiting the hallmark of that civilized society. The other issue I think that you raised was the issue of the ambulance. I think, Gitonga, you raised the issue of the ambulance. And yes, you and I are going to get together. If we can get a tax-free status for this entire organization, there is no reason really why you should not get an ambulance paid just because of duty. I think what has been happening perhaps in the past is that people see the tree instead of the forest. Once you begin to see the forest and appreciate that whether you pay duty, you can either pay duty in terms of money goes to the exchequer, but if you don't do the hospital, then you pay more money than the duty when people are not treated. So once you understand the concept of national care, then you begin to very quickly take care of some of those things. The issue of the president visiting this institution, again, I will take your requests to the president, and I'm sure, given that his father was here,